Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Did you know that April is Parkinson's Awareness Month? Did you also know that over 10 million people worldwide are living with this neurodegenerative disease, including celebrities such as Michael J. Fox, who was diagnosed at age 29, boxer Muhammad Ali, and singer Neil Diamond? In today's episode, I'll discuss how Parkinson's disease works, how it's diagnosed and treated, and how advocacy from you can raise awareness, research dollars, and support for people with this chronic brain disease. You can save lives. Let's get started. So, what is Parkinson's disease? It's a progressive disorder that occurs when a certain region of the brain that controls movement, the substantia nigra, gets damaged. The nerve cells in this area of the brain make a neurotransmitter called dopamine, which sends messages to control movement from walking and talking to playing the guitar and smiling. When the brain loses enough dopamine, symptoms develop, including tremors, slowness, rigidity, swallowing problems, restless legs, and many others. This clip from the Colorado Neurological Institute demonstrates an abnormal gait.
This patient takes slow shuffling steps and has trouble turning. She has flexed posture of the trunk and arms with reduced stride length and slow speed.
So how is Parkinson's disease diagnosed? There's no one blood test or imaging like an X-ray that can confirm Parkinson's. It's a clinical diagnosis. In other words, a patient's history, symptoms, and physical exam are used to make the diagnosis. Certain tests, however, can support a doctor's diagnosis, such as positron emission tomography, or PET scan, an MRI, and a dopamine transporter scan, as well as blood work. How is Parkinson's disease treated? While there's currently no cure for Parkinson's, several treatment options are available and they should be tailored to the patient's symptoms. Exercise, physical therapy, occupational therapy, and speech therapy can be very helpful. Medications can also relieve symptoms and improve quality of life by stimulating the remaining brain cells to produce dopamine or by inhibiting acetylcholine. Levodopa is the gold standard for Parkinson's therapy. It enters the brain and is converted to dopamine. Levodopa is combined with carbidopa, an enzyme inhibitor which prevents levodopa from getting destroyed. Other medications include dopamine agonists such as bromocriptine and ropinirole, but they generally have more side effects than levodopa, such as drowsiness, nausea, and dry mouth. Selegiline, benzotropine, and amantadine are other medications used to treat Parkinson's disease. In addition to exercise and medications, surgery can be another treatment option. Neurosurgeons may perform a pallidotomy, where a wire probe is inserted into the globus pallidus, a part of the brain that controls movement and is thought to become hyperactive in Parkinson's. Thalamotomy uses radiofrequency energy to destroy a small part of the thalamus in order to relieve disabling tremors. A safer alternative to pallidotomy and thalamotomy is deep brain stimulation, or DBS, which is sometimes described as a pacemaker for the brain. Small electrodes are implanted in different parts of the brain involved in motor function or movement, sending electrical signals to rebalance electric messages in the brain and hopefully reduce tremors. Watch this video with Harry undergoing DBS at the University of Michigan.
Tremors, essential tremors. I had this hand done last year.
How are you doing, my friend? Good. You look like Kelly got a hold of you. Good.
Deep brain stimulation surgery occurs in 2 stages. The first stage is the placement of the electrodes very precisely into the brain, and the second stage is the placement of the implantable pulse generator, which we call the battery. Did you feel something in your hand? What did you feel?
Like a shot.
A little shot. That was the lead going in. At the University of Michigan, most often deep brain stimulation is done awake. The reason for this is that it's absolutely critical that we know that we're in exactly the right spot. Even in the same disease, different patients' brains are different. By having the patient awake in the operating room, there's an opportunity for Dr. Chu and Karen Cluin, our speech pathologists, to rigorously test the patient and make sure for that patient the lead is in exactly the right spot.
As fast as you can. Go.
Huckleberry, 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 huckleberry.
Perfect. You can stop. So you did 7 huckleberries in 5 seconds. You're doing okay.
Yeah, I'm sure.
Actually, do you know if your place in Florida is okay?
As far as I know,
Yeah.
I think I still have a roof.
Okay. All
Yes,
right.
that's it.
Today is my first visit with Dr. Chu to have my settings made.
So when we test them, you can turn on the stimulator and you can see a tremor basically melt away almost immediately once you get the right setting.
So how can you make a difference? Living and helping someone with Parkinson's disease can be very challenging. So it's incredibly important to get support. Here are just a few amazing organizations that you can learn from, donate to, or volunteer with. Parkinson's Foundation, the Michael J. Fox Foundation, the American Parkinson Disease Association, the National Institute on Aging, and the National Institute of Neurological Disorders and Stroke, or NINDS, and many more. Well, that's all for today. Here's your joke of the day, spring themed. What did the patient say when he was told that it's allergy season? Ugh, you must be pulling my leg. Well, be sure to subscribe to my YouTube channel, write comments below, and follow my Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.